Welcome to our interview series on Technology Impact Assessment, otherwise known as TIA. My name is Katina Michael. I'm a visiting scientist from Arizona State University, and I'm also a fellow at the Social Cyber Institute in Australia. This interview is part of the Australia-India Joint Impact Assessment of Critical Technologies for Peace and Stability project, and it's funded by the Department of Foreign Affairs and Trade and has been ongoing since November 2024. In this series, we're focusing on technology impact assessment for peace and stability, and it gives me great pleasure to welcome Shefali Malhotra with us. Hello, Shefali. A short bio on Shefali's work, and she'll say more to us in a moment, but she's a health policy researcher based in New Delhi. She's a fellow in global journalism at the Dalla Lana School of Public Health at the University of Toronto in Canada. Shefali, is that correct? Is that what you're doing at the moment?
But my fellowship got over. So at this point, I work as a senior researcher with an organization called the Center for Health, Equity, Law and Policy, which is a research institute started by Indian Law Society based in the city of Pune, which is in the western state of Maharashtra. To give you some context, it's about 3 hours drive from Mumbai. That's where I'm working at the moment. But I also do some freelance writing, on anything and everything related to technology and health.
And was that inspired by some of the training you had at Toronto University, or it's something you've always had a gift to do and a passion to do?
Background is in law and political science. I started my career, in fact, working in the HIV/AIDS movement in India. And that's where my first interaction with health and health policy happened. And so I was working there. I was mostly providing legal support, litigation, public interest litigation, as well as providing legal aid. And from there, I moved on to wider, working on the broader health system in India. And so for many years, I was involved in issues related to health financing, healthcare regulation. As we know, in India, the private health sector is pretty big. And so how do we regulate different entities in that ecosystem? And after that, I went to do my MSc in political science from Leiden University in Netherlands. And when I came back, I again got back to doing health policy research. Mostly, for the past 5 years, I have been focused on digital health technologies, but I also examine, government-funded health insurance programs in India. I think 2, 3 years ago, I did a fellowship at the University of Toronto, as you mentioned, which was fellowship in global journalism. The purpose of that program was to train experts in whatever field to do more journalistic work. And since then, I have also been doing freelance writing on these issues.
Frame for us the context of being a health researcher in an organization like yours. It's a not-for-profit, is that correct?
Yes.
Tell us, because you've got this interdisciplinary backdrop of skills, law, health, the journalism practice and fellowship in Toronto, in Canada. Why is it important for us to have skill sets like yours today in the world that do work in the third sector? And frame for us, what is the health situation globally?
Why is it important to have a background like mine? So I
Yes.
think that especially because I've been in the health sector, Earlier when we thought about health, we thought about doctors, we thought about clinicians, we thought a lot about medical practice. But today we understand that healthcare is much more than that. It's a lot about preventive healthcare. It's more not just curative healthcare, but also preventive healthcare. And when we talk about prevention, I think that brings into play many disciplines, outside of medicine. It can be epidemiologists, it can be engineers, it can be policy researchers, it can be a wide variety of backgrounds. Also in the past few years, something known, WHO, what it calls One Health, where we understand that especially in public health programs and in any kind of public health interventions, you probably need, different backgrounds to come in and work together. And so even that understanding is there, that it's not just one discipline that works in health, but it's a variety of disciplines. Um, in terms of doing journalism, why I was interested in that fellowship was because a lot of times, my essential background is research, academic and policy research. But I thought with this fellowship, how to convert what we write, which can be very technical, which can be very dry at times, how to reach out to a wider audience in a way that they understand, in a way that they also get interested, in topics generally which are confined to academia or to policy spaces. So essentially, that was my interest in doing that. So I do think that having my background is an asset in a field like mine. Yeah. What was your second question?
Um, and what got you involved in this kind of journalistic aspect? And I think you've answered that, Shefali, with regards to the
Yeah.
communication and translation for everyday people. Would you agree?
Yes.
In the organization you're in at the moment, can you tell us some of the processes you're involved in? What does a day look like in your life? Is it focused specifically on India and health research in your particular province or in India wide? And how does that impact society?
In my organization, essentially, our vision is to, towards realization of the right to health, as recognized by the United Nations, and assessing laws and policy, but also how different programs are getting implemented, using a rights-based lens. And so to assess different aspects, does it improve access? Does it improve availability? Does it improve quality? Does it, is it equitable? So all these different aspects we assess. Basically that's the broad vision with which my organization works. Um, in terms of what is my day like every day, so I work remotely. So I don't, most days I don't go to a particular office. But essentially I start my day, I have a team call, with my group, and we discuss what tasks we have to do. And then, we carry on with that work. And then the next day we update each other. But these are mostly, projects. Then on a higher level, first we have a work plan, we have projects that we have planned, and then we prioritize those projects, and then we attempt to complete them one by one. But as you know, with research, sometimes there is delays that happen. So yeah.
And are you conducting predominantly primary research, secondary research, a mix of both? Is it qualitative, quantitative? Can you give us an idea?
Yes, we do a mix of both. We do collect primary data where it's needed by doing interviews in the specific project context that we're working. We also sometimes do focus group discussions, and we've also done a few surveys. But we also do a lot of secondary research. We file a lot of right to information requests, and if we do manage to get good data, we like to analyze those data, examine that information that we have got, and we also do a lot of legal research,
Mm.
legal law and policy research as well.
And am I correct? Is that within the Indian context, Indian law?
Yes, it is specific to Indian context. We do comparative research as well, but the main context is always India.
Wonderful. You've been amazing to be with us in our webinars and roundtables whenever you've been able to. Tell us what attracted you to the notion of technology impact assessment and how it relates to your work.
So, in the health context, technology impact assessment is not a new concept. We call it health technology assessment. The idea is to assess technologies to understand, the societal, the economic, the ethical aspects of it, impact of implementing a technology. It came into being essentially when universal health coverage, people started understanding. People started implementing universal health coverage around the world. Then, because government was spending money, it was taxpayers' money, it became important to assess what things are getting implemented. And health technology assessment is also broader than pure technology because sometimes it also involves assessing the impact of public health programs itself. And yeah, so in the traditional sense, that's what health technology assessment we understood. We advocate that because we believe that especially if taxpayer money is being put in somewhere, we have to assess the impact of it. We have to be economic, cost efficient about it, effective about it. Um, Broadly, that's what, and also, involve communities affected by it. It's one way to get community input, although I must say that most governments don't really pay attention to that aspect. But the idea of a technology assessment is, one integral idea of it is to involve communities to, get direct feedback from them, and, either implement the technology within that context, but also once it's implemented to how to adapt, how to improve, how to modify based on the needs of that particular population. Now, today, with digital technologies, becoming everywhere, people, different organizations, governments, in fact, are talking about now what we now call as digital health technology assessment, so DHTA. I think in the UK, there's an organization called NICE, which already has developed a framework for digital health technology assessment. But there are also other organizations which are beginning to think and work around this idea. So we have the HITAP in Thailand, which is exploring, even in India. Even though in India, forget digital health technology, but the health technology assessment framework is very, very nascent. It was only introduced in 2017. There are very few assessments we've done as such, but we are also now thinking about digital health technology assessment. So, yeah, I hope I answered your question.
Oh, you did, and it shows the depth and breadth, definitely the historical context of health technology assessment and now this new digital health technology assessment, sort of separating other technologies, from digital technologies, which we might delve into in a moment. Um, can I ask quickly, how many people are in your organization, and is it funded by government or funded by donations?
It is essentially funded by donations. Um, and there are about, I would say about, I would say 10 people. It's a small organization, yeah.
Yeah,
We actually started in the middle of COVID. So yeah, it's relatively new as well.
that's to me as a researcher as well, fellow researcher, not in the health space, but I am constantly amazed by the size of problems that small uh, units can actually begin to investigate and have impact in. And the impact sometimes can be uh, quickly seen, and other times may take years to build a strategy towards fulfilling. And but I'm constantly amazed by the researchers in these not-for-profits or non-government organizations, small groups tackling massive problems, right, in society. And sometimes I don't know how you might feel as a researcher. You think, oh, this is such a big problem, or how do you how do you psych yourself up, knowing the day-to-day challenges that you meet in data access and other things and the problems themselves. How do you think about these um, local and global challenges?
Um, uh, I don't get too bogged down by the impact of my work or my organization's work. I think that's the most for me. That's the most sane way to keep moving. I believe let's say for example, I put out a paper on any topic. Um, you never know when it creates impact, right? It could
Hmm.
have, if somebody takes notice of it immediately, but it could also be 10 years down the line, somebody comes across it and starts building on it, or some policymaker sees it and, it clicks. It could, I mean, it could be any amount of time, right? So I personally believe that we should take pleasure in the small achievements, which could also be publishing your paper, or having been able to reach out to a policymaker and discuss your ideas. So I believe in that. I don't get too bogged down by, oh, what is the broader impact my work is having,
Yeah.
because that I feel is not in my hands.
And may I not put words in your mouth, but it's almost not the point of why you're doing what you're doing. Um, the broader impact will take care of itself. Um, if it's meant to happen, may I ask the strategies that an organization like yours will use to publish their work? Is it on your website, for example, if I visit, and which website is that? Or are there other strategies to disseminate and communicate the outcomes of your work?
So yeah, essentially, the first thing we do is we publish our work as working papers on my organization's website. So yeah, so we put it up on preprint servers as well for wider reach.
Oh, yes.
And we also do some talking about our work and specific papers on social media through my organization's social media handles. But we also send out emails. We have a contact list of our allies and other people who we think who we think we could influence. And so we take out a newsletter giving in brief what are our findings and then the link to the main paper. Many times we do get feedback from that, and we've also sometimes had situations where journalists have covered our work.
Hmm.
Um, and now we also want to start doing broader outreach. So we are thinking of things like holding webinars, and maybe also now having small roundtables where we can present our paper and actually get very detailed feedback. So maybe a half day, something like that. So those are all the different strategies. But this is working papers is just one kind of product that we come out with. We also do issue briefs. So where we, for instance, we published an issue brief on the data protection law that came out, specifically discussing its impact on health data, and how, where, what are the good and bad things about it. And so those kind of things, then we also have, community organizations or even academic institutions, which also come to us to ask us to train them on these laws in terms of how they can comply with it, but also discuss broader issues related to it. So it's a mix of different kinds of strategies, and it depends on the product and how do we think, the advocacy for this product should move.
Thank you for that description. I think it'll be enlightening for a lot of people to think about structuring the dissemination of information in that way if they are part of the third sector. Um, you distinguish between health technology assessment, which you said has been around for decades and decades, which we're finding the same in the literature, of course. That and climate assessment, technology assessment, seems to be the two very well entrenched technology assessment verticals. But then you also talked about digital health technology assessment, and my query here is, if I was to say to you, the top 10 critical technologies in this health space are, and would you, in this instance, distinguish between those that were sort of classical tech and then the digital modern tech in the health sector? How should we think about it in our minds?
Um, so, um, So health technology assessments in the traditional sense, where you're testing maybe a medical device or a medicine and things like that, that process is considered actually very long, and that's why people are thinking of new ways to work with digital health technologies, because a lot of especially chatbots and things like that, they probably don't need such an intensive long procedure. So people are basically thinking of a process which is not so long drawn, but still at the same time, there is some level of assessment that is going on. Uh, yeah.
Could I ask,
But
go
but
ahead.
but it, sorry, yeah,
No, no,
it
go
is
ahead.
still in a very nascent state. So I think even there we would need to think, what kind of digital technologies. So for instance, maybe an image recognition AI, for instance,
Hmm.
would require more intensive uh, evaluation than maybe a therapist chatbot. Um, yeah.
I'm amazed to be hearing the examples that you're providing, but of course, in this space, and a typically long health technology assessment, excuse me, would take how long? Are we talking several months, a year? Um, Give us an average. Of course, it's context specific, but what would
Yeah.
be in your mind a long health tech assessment project?
I think it would be anything, probably which takes more than 6 months.
Yeah.
Hmm.
And a short-term one?
To maybe a month, 2 months, up
Yeah.
till 3 months, I would say it's a short assessment period.
Yeah. And the tell us about the context of India with regards to the uptake of new emerging technologies, whether it is things like imaging systems or generative AI, or AI to help in diagnosis with pathologists, for example, or in therapeutic technologies such as uh, chatbots for the everyday, populace. What are you seeing in the market in India? Uh, Happily adopting new technologies, testing, and where it doesn't work, just stop using them. What's the pattern?
So there's a lot of uptake. There's a lot of interest. There are a lot of collaborations we are seeing between government and private organization, private technology companies, to develop all kinds of technological tools, and as well as hospitals doing all kinds of. So, for instance, we have something now known as tele ICU. So, for remote areas, where doctors are not available. So, creating a system where a doctor can remotely, monitor and provide interventions to a patient. We also have a lot of image recognition AI that is being implemented, remote monitoring of patients, not in terms of ICU, but also their adherence to medicines, the real-time evaluation of their vitals and things like that. Then there's a lot of chatbots, of course, for therapy and other things. So there's a lot of uptake in terms of assessment. Is anybody assessing them? My answer is no. Right? So we are basically relying on what the government is saying, and what companies are saying, but an independent evaluation and a comprehensive evaluation, that is not happening. So it is very difficult to say what is the impact, how beneficial is it, and what are the harms that have come with it, and how do you how do you balance the two? I also want to add that apart from medical stuff, we are also seeing these technologies now being used for in disease surveillance. For instance, we had a lot of all over the world. We had contact tracing apps and things like that. We are also using them a lot in public health programs to automate testing, eligibility, registration. There's a lot of facial technology that we're using. And so it's in a lot of wide contexts, but there is no testing at this point.
That's fascinating. And I can see it's a trial and error kind of adoption. And if it works, keep using it. And if it doesn't, the market will dictate that. A very open market from what it seems. And I can imagine the emphasis and the push for more innovation from a economic standpoint with regards to things that perhaps India can then sell beyond its borders. But interesting that it's almost a try it and see if it works mentality rather than, be hesitant, be careful what kind of uh, feedback loops you get stuck in with chatbots that may not give you accurate data, for example. Shefali, what kinds of criteria would you like to see in a health technology assessment that's done by your organization? What are the elements of that kind of TIA report?
Okay, before I start, I would just like to say my organization, we don't actually do the technology impact assessments, and
Yes.
we are not experts in that either.
Yes.
We come from a more policy, philosophical perspective on it. But to think about what are the essential things that we would like to see, one is any technology that we're using, it's collecting a lot of sensitive data. And so we want to see what are the processes and systems put in place to maintain privacy and confidentiality of patients. Because that is one of the cornerstones of any kind of healthcare. And so that is the topmost priority. Secondly, how accessible is that? Is it only accessible to a certain section of society that can pay for that technology? Or maybe because of where they are placed geographically, or in other senses. So access is very access, and how available is it? Third thing is, in real terms, we want to understand how does it change and improve, if it does, the quality of healthcare that the people will now be getting. but we also want a very clear assessment of the risks that come with it. What is the potential for harm? What is the potential for discrimination? And like these are just some examples. And what are the processes, systems being put in place to mitigate these risks? But before that, we also want a clear assessment of what is the benefit and what is the harm, uh, and to assess whether the risks that come with it, whether the benefit that it brings, is it worth taking on the risks that it affects. We would also like to know, you know, how communities were involved in development and deployment of these technologies. Um, One factor is, of course, like we should be consulting communities who will be affected by this, and who will also be using it. But also that gives a sense of what contextual factors have been taken into account while implementing and developing this technology. So, on the top of my head, these are some of the broad things I can think about.
It's amazing that you emphasize the importance of community so often in your discussion so far, and that there needs to be a level of transparency, that the very reason that you do a health technology assessment is so that people are more aware of what they are adopting and interacting with, and they're aware of um, the risks in a proportional sense. I think that's what you mean in that proportionality principle. And Shefali, it's amazing that you keep emphasizing the importance of community and of people and citizens and society being aware of the kinds of technologies they're adopting in a proportional sense. Um, Tell us who the stakeholders are in this kind of digital health ecosystem. Who are the main players, apart from citizens that you've mentioned, and government that creates policy?
So I think apart from citizens and government, uh, is the companies or research institutions that develop these technologies. I also think the people who will use this technology. So that could be from your doctor to your paramedics to your frontline workers. And it's also important to assess, when we are doing assessment, to understand how it impacts their work, you know. Because a lot of technologies, because now everything is data, so there's a lot of data entry work which actually falls on the frontline workers. And there's ample evidence to show that it has actually taken them away from patient care. um, and we have anecdotal evidence from patients themselves that healthcare has become is no longer personalized. We go from one spot to the other. They tell us what we need. No explanation. There's no interaction. So yes, I think people who will ultimately be using this technology is also important. Then, of course, the communities who will be affected by it. But also, probably policymakers who can then gather this evidence to develop policy related to digital technologies.
Historically, have you found that governments around the world have responded to tech assessments done by organizations that are independent? Do they listen, or do they say that, oh, good health technology assessment, but how do I use it? Do they know how to take the outcomes from the reports and actually use them towards an implementation of new policy or adapted policy?
So in the Indian context, I think it is very ad hoc what the government takes and what it doesn't take. There is some aversion there has been some aversion with all governments. If they are fixated on an idea, then they want to implement it, and they are not so forthcoming, uh, with any kind of maybe critical feedback that comes from it. Um, but I would say that it is ad hoc. Sometimes they do take on, sometimes they don't. And instances where they do take on are lesser than when they don't. Yeah. But that said, I think there are a government themselves, like India does have, a health technology assessment board. It may not be as active as we would like it to be. It's also very new. It only started in 2017. Um, so I think that it's not just about taking on assessments and the critique and the good and the bad. I also think there are a lot of capacity constraints in actually conducting a proper assessment. It's a very resource intensive, time consuming, process. And I think that's also a big limitation of why it is, it's not taking off the way we would like it to take off. I also think that there's a lot of resistance from companies that are making these technologies and that will ultimately be deploying them, um, uh, because they see it as a hindrance to innovation. That they see, what do you call that? Like in India, we call it something known as license Raj, or too much bureaucracy. And we need quick innovation. We need fast innovation.
What's
So
that
there are a lot of
called? License lag, did you call it?
no, no, no. So we call it so in India at one point, everything you need to go get a license for.
Oh, yes.
Uh, and so it came to be known as license Raj. Raj is a Hindi word and it
Yes.
translates into rule, in English, in
Yes.
very simple
Yes.
terms.
Yes.
So this is not exactly that, but it comes from that mentality that there's too much bureaucracy, and our innovation is going to get stalled unnecessarily.
Yes. This classic problem. And Gary Marchant at the Arizona State University has written about this, and there are many diagrams depicting this. We want to race ahead with innovation, but the law is lagging behind. And thus, d do you allow for more freer implementations in innovation
Yeah.
spaces and allow the industry to dictate and the people in the market to dictate what they adopt? Um,
Yes.
you alluded to the importance of community participating in the development of technology, and you fell short of calling it co-design, but I know that's what you're talking about. Um, when you look at a technology's life cycle, any technology, and you look at when we should intervene with a digital health technology assessment, at which part, right at the nascent stage before widespread diffusion, or somewhere in the middle, or somewhere at the end of a technology's lifetime. And then you talk about this co-design element where there's community participation in the development of new technologies in the health space. Can you tell us if there's an ideal situation that you would love to see over time? Do you think all technologies in the health space that presume to have a large impact on society, do you think we should be doing digital health technology assessments sooner than later?
So I think that three stages you outlined. I think assessment is not a one-time process, um, and I think that it has to be it's through the whole life cycle, which starts from when you're developing the idea. I think to take it, let's for instance, we have a health technology assessment board here, and there'll be similar regulatory organizations in other countries. To take it there, to float it as build a sort of prototype and get an initial get go that okay, we this is worth it, you should develop this further. Then when it comes, before we fully deploy it, I think there should be a bunch of pilots that happen. Those pilots should be thoroughly assessed, feedback, what feedback we get, it should be used to improve, modify what we are deploying. And then we start in a phased manner, I think, where we think it's needed the most, we start there. But assessment and collecting feedback should be a continuous process. And once it is fully deployed as well, I think we still need to assess it at least for a few years. Um, and to then adapt it, because for a country like India especially, right, we are such a diverse, we are such a big country. So it's
Yes.
not that something I will put in Maharashtra, for instance, will have the same impact in a northeastern state, and so I think you will still need to adapt it to specific contexts wherever it is. So I think it's through the whole life cycle process. And I think communities play an integral role, especially when those implementations start happening, to collect feedback from them. But I also think that at the stage of designing, I think it is important that stakeholders that are involved in designing, they should already go and start talking to communities to also understand what exactly is the need within the community, right? So you develop a technology which actually helps, rather than what in your mind will be helpful. So yeah.
That's a fantastic reply, and also really talks to the innovation process and how closely it's tied with technology impact assessments of all kinds. You talked about gently there this notion of joint, if I heard correctly, and uh, do you think there's the possibility that digital technology health assessments can be done jointly with other nation states? You alluded to earlier in our discussion as well, perhaps India working with another neighboring country. Um, do you think that's possible? Does it happen in health technology assessments?
Yes, I it does happen. There is, I'm not, I don't think in terms of like doing the actual assessment, or maybe I am not aware, but
Hmm.
I do know, like for instance, in HITAP in Thailand, that is a well-known organization, and it has, this HITAP has the HITAP International Unit, which works with different Asian countries also to build their capacity, and things like that. And they're probably doing some joint assessments. I do see value in doing that, especially for countries where technology or health technology assessments are not very entrenched. We also think that um, how to be the most resourceful while doing these assessments, right? Jointly, I think, and there's, it can be a more comprehensive assessment, and there is more sort of a holistic view that you can get. I do, so there is value definitely, but I also think that there are roadblocks, you know. So one is that I think when you do it jointly, I think it becomes a bigger project, and so it becomes even more resource intensive. I also see concern in terms of geopolitics, because then it also depends a lot on the relations between the country and how that is changing and the political environment. But I also think we have to guard against it can be a situation where a more powerful developed country may try to, sort of dominate a developing nation. So I think these are also factors that we need to guard against. But yes, there is value. And I think HITAP especially has been working a lot, at least in Asia, in Southeast Asia and South Asia.
That's a wonderful response and very enheartening. I was going to ask you a question on the relationship between health technology assessment and peace and stability.
So I think, see, if we do health technology assessments and we really implement technologies, that help society, that improve quality of care, that improve access, ultimately improving health outcomes in the long run, um, I think that contributes to peace and stability, because we are just in a healthier society, and so that helps. But I do think, even technology assessments of, um, things in crisis management. For instance, there's a disaster, there's a lot of we require a lot of drones these days. And those kind of situations, if those technologies properly assessed, properly implemented, those can really help the world in those kind of in crisis, basically. So I do see its role in broadly promoting peace and stability. I think it can also be used to, spread um, spread information, reach out to a wide audience, wider population, to give them accurate information. And if there are rumors, then to be able to, decisively address those rumors. And that also helps in peace and stability. So these are a few ways I think it can help, but I'm sure there are more.
That's fantastic. I have a last question, which is from the last 6 months, where we have been working in the group at large, and your experience from health technology assessment. Uh, is there anything you've garnered insights into, or you want to share with us about this topic that we haven't covered today in the interview, but you think is emergent from the work that we are all doing together?
So I think, I mean, I myself have emphasized a lot about, communities and involvement, and all that is great. But I think there are two fundamental factors that technology assessments should keep in mind. One is that technology cannot replace, at least in the health context, but I also
Mm,
think in other contexts. But technology cannot replace; it can assist. But in developing countries, especially, we have this attitude that we'll put this AI technology and this system will start working perfectly fine. That was the thing that was missing. So I think that is something that technology assessments should definitely keep in mind. And secondly, is that when we are deploying technologies, when we are designing technologies, we should be thinking, and this is at early stages when we are just considering a particular innovation, about the need for that innovation, whether there's a real need for it, um, and also uh, what will the public benefit from it, and how can we ensure that that benefit goes to as much public as possible rather than only certain sections.
well, Shefali Malhotra, this has been one of the most inspiring interviews of the whole set.
Thank you.
Thank you for your dedication to your craft and for all the things that you do in your day job. It's amazing to be worlds apart, literally, but to feel and sense somebody's vocation elsewhere. I learned so much from you today. I'm sure our listeners, if they will hear this when we get through that part, uh, will gain a lot as well. But thank you for your time and energy, and may you continue to do those beautiful technology assessments, positively affecting the public interest. Thank you.
Thank you so much.